Hello everyone, my name is Jose Barrios. I am joined today by the rest of my colleagues, Marissa, Kyle, John, Said, and Mary. We would like to share with you our industry analysis on remote spirometry. This is the agenda for today's presentation. We will discuss the overview and scope of our industry, market size, market segmentation, stakeholder analysis, and our market forces, and we'll mention one notable market trend. The spirometer is a medical device that is used to measure the volume of exhaled air. One metric that is used is the FEV1, the volume of air that you exhale in 1 second. Another metric that is used is the FDC, the volume of air that you exhale after maximal inhalation. The calculated ratio between these two will determine the severity of the lung function. There are many illnesses that will obstruct outward airflow. One such condition is COPD. According to sources, in over 50% of COPD cases, spirometers have never been used. Interestingly, by the time COPD is actually diagnosed, there has already been irreversible lung damage. With the advent of mHealth and telehealth, the spirometer can now be used remotely by using an app on your phone or desktop. Live data can be transmitted to an EMR for a clinician's review. Disease progression can be assessed, and treatments can be initiated or modified in an efficient and timely manner. The incidence of COPD will increase as more of our population ages. Therefore, the demand for spirometers will increase. To accommodate this need, the supply will have to increase. My colleagues will now enlighten you with several insights into the industry.
To calculate the market size for remote spirometry in the United States, we decided to use a top-down approach. As we will discuss on the next slide, COPD is most common in individuals aged 65 years or older. Using an average device cost of $200 in a US population of 55.89 individuals based on 2020 census data, this represents a total addressable market of $111.8 billion US. From this cohort, a service addressable market was identified as 15 million Americans diagnosed with COPD, or $2.5 billion. Using the assumption that those with adequate insurance coverage will most likely use remote spirometers for the management of their COPD, we calculated from 2020 CMS information a reported service obtainable market to be $1.2 billion US based on 6.15 million current Medicare enrollees diagnosed with COPD. As we will later discuss, all three of these markets are likely to continue to grow based on an aging global population.
We applied standard market segmentation practices to identify target customers. Based on our research and industry knowledge, the primary segment appears to be COPD patients that are 65 and older. According to COPD.net, other demographic factors that define this segment include patients living in Southeast and Midwestern states, especially rural and lower income areas. Additionally, females appear to represent more COPD cases. There is also an association with smoking tobacco. From a B2B perspective, physicians treating patients with COPD are a target segment. According to the Medical International Research site, a key driver to adopt this technology is to decrease related medical and hospital visits. Based on this information, we infer three things about target customers in this market. One, they are cautious, trying new technology and tools. Two, they're price conscious. And three, they could benefit from hands-on support and training when it comes to implementation.
The stakeholders were analyzed based on their level of interest and influence in the market. Starting with the highest level quadrant, we show physicians and patients as having the most significant influence and interest. As the end users who will either utilize the device or monitor the results, they are most affected by its accuracy and functionality. Engaging them through user-friendly designs and meeting their needs is crucial for post-market success. To the left, we show that regulators such as the FDA and payers possess high control over market success and reimbursements. While their interest may be low, their decisions to market or reimburse the device can be rate limiting. So it's important to offer them compelling data on regulatory compliance, clinical evidence, and cost effectiveness in order to convince them and gain their support. Moving down to the lower right quadrant, we have manufacturers as having limited decision-making power, yet a strong interest in the success of their product. Their active involvement can increase patient awareness and retention, and they should aim to engage and collaborate with other stakeholders to leverage their research and promote their product. Lastly, in the lower left, we showed that medical institutions generally have minimal influence and direct interest. They may not find it ideal to integrate this device into their infrastructure and workflows given the high costs and efforts to do so. With that, they may lack organizational support, but may find value in improved patient outcomes and operational efficiency.
Non-market forces in this remote spirometer industry consist of the following. On the public policy front, even as successive political administrations have promoted remote patient monitoring programs as a key to improving health and reduce spending, around 20 states' Medicaid programs don't reimburse for remote patient monitoring. On the economic side, studies have shown fewer urgent care, ED visits, and hospitalization with home telemonitoring on patients with COPD. Home monitoring programs have shown decreased healthcare utilization and savings. On the social or customer front, patients' experience with remote patient monitoring devices has been highly satisfactory. Examples are studies done on ICD devices. However, physicians should address patients' concerns about privacy issues. On the technological side, market reports indicate that demand for remote patient monitoring will increase. However, a lack of broadband connection will be an ongoing issue for many patients, especially those living in rural areas. On the legal front, Federal Trade Commission has come down hard on telehealth companies with regards to their data sharing practices, with recent example of reaching settlement with Teladoc Health Incorporated. On the environmental side, telemedicine adoption has reached 80% mark, while 46% respondents reported owning a wearable device per a recent survey. This saves transportation costs for patients and energy costs for providers, hence decreasing carbon footprint.
We are expecting the global spirometer market to trend upwards in the next years up to 2028. The market growth is expected to be at 9.5% for various reasons, like an increase in um, diseases like COPD, other breathing difficulties that people are facing, and also because of the availability of monitoring apps, handheld remote spirometers, and other devices, even though not everyone has access to those devices. And sometimes, if not used properly, people can have inaccurate readings. I actually do have a spirometer right here, just to show you how easy it is to use. Just press it open, device opens, deep breath, breathe out, device gives us a result. Obviously, that wasn't the best effort, but I'm still in the green. We can transmit those results through our connected to a computer device to our doctor, and the doctor can interpret the results. So this is one of the main reasons why we expect the market to grow at such an increasing rate in the coming years.